Good afternoon. We appreciate, and I know I speak on behalf of Marion as well, that we appreciate that everyone continues to pay attention, and we want to keep you as updated as possible about COVID-19 and the situation here in Prince Edward Island. There are no new cases of COVID-19 to announce for Prince Edward Island today. We've received 118 negative test results, new from yesterday. And when we look across the country, there are over 30,000 cases of COVID-19 and close to 1,200 deaths, putting our case fatality rate around 4%, which is lower than the global case fatality rate of 6.9%. So we continue to have in P.E.I. the total of 26 cases, 23 who are considered recovered. As we head into another weekend, I'd like to remind Islanders that what we have all been doing has made a difference, but it is important that we continue to follow the public health measures. It is still important to stay home as much as possible, and if you're heading out for an essential reason, practice physical distancing. Self-isolate if you have traveled outside the province. And for essential workers who are traveling to our province, such as, and I've mentioned the truck drivers before as essential workers, but essential workers, including truck drivers, means that when you're here in Prince Edward Island, you self-isolate when you are not at work. Of course, all the things we talk about, it feels like all the time, continue to be important about hand washing and practicing good cough etiquette. And if you're experiencing any symptoms related to COVID-19, contact your family physician, nurse practitioner, or call 811 and we can arrange to have you tested for COVID-19. We recognize that these are challenging times for all of us. We are staying away from people we love. We are staying away from things we love to do. But I'm also concerned about the increase of alcohol and drug use and other risky behaviors in our province. It's important that we look after each other's mental health and our own mental health and our physical health, and we look after each other's. Our alcohol use, drug use, and other risky behaviors influence our health outcomes, not just in the short term, but over the long term as well. I think, for instance, it's important that we follow our low-risk drinking guidelines, which means for women, 2 drinks a day, up to and no more than 2 drinks a day, and for men, up to and no more than 3 drinks a day, and no more than 10 drinks a week for women, and no more than 15 drinks a week for men. And there's certainly more information about what those low-risk drinking guidelines mean for Islanders and Canadians. And just one example of how important some of these risk factors are in our overall health. And there are certainly resources through Health P.E.I. with a number of support programs available for our mental health and addiction. And we have websites available and the Island Helpline as well. And that's a 1-800-218-2880. In terms of travelers to P.E.I., and I'd like to clarify that during the period of this 2-week state of emergency at this point in time, some individuals who are traveling to Prince Edward Island should call the Emergency Measures Organization and by 902-894-0385 or by email publicsafety@gov.pe.ca. But if you are an island resident and permanent island residents, for instance, with a P.E.I. driver's license, essential workers, you do not need to call ahead to make those arrangements. And certainly we'd encourage people who, for compassionate reasons, are wanting to come to P.E.I. or who need to come to P.E.I. and should, please contact them so that that can be facilitated through the EMO, and then working with highway safety. EMO has received a number of inquiries since yesterday and are asking for people's patience today as they do their best to return travel-related inquiries within 24 hours. They received a large number of calls yesterday afternoon and emails. And our process here complements the border controls and screenings that are in place both in Nova Scotia and in New Brunswick. If you are calling with COVID-19 inquiries and more general inquiries, please continue to use the COVID information line, which is the 1-833-533-9333 number. The screening is working well, and we appreciate the cooperation of everyone traveling. This coming weekend, we will not have any scheduled public health briefings planned unless there is a significant change where I feel it's really important that we all know something that has changed, and that would include receiving a number of new positive cases, and I will be back to do a public briefing at that time. But we'll continue to provide updates, as we always do, on negative results over the weekend, and that will be via advisories to the media and social media and the COVID-19 information page on the government website. Every day I want to thank Islanders, and I want to thank them again today, and thank you for continuing to follow public health measures. What we are all doing is making a difference, but it is not over yet, and I think it's important that we're careful. We need to stay the course and keep going. If we ease up on our measures too soon, we run the risk of letting COVID-19 spread, and we're not there quite yet. We've talked this week about looking at what easing up in Prince Edward Island could look like, and that's easing up in our health system, with businesses, and in our community. And I think there are really important discussions to be had, and my hope is that we can share a framework of what that could look like in the weeks ahead sometime next week. I know it is difficult to be physically distant from family and friends, and I know we're doing all sorts of wonderful things in finding new ways to connect. It's not only that we will get through this together, we are getting through this together, and we're doing it one day at a time. And as my friend and colleague on the other side of the country says, and I couldn't say it better, be kind, be calm, and be safe, and how true this is. Thank you. Et en français, bonjour, bon après-midi. Encore aujourd'hui, il n'y a pas de cas positifs dans notre province, mais je vous confirme qu'il y a 118 tests négatifs qui sont nouveaux depuis hier. C'est toujours 23 cas rétablis et 26 cas au total. Au Canada, il y a plus de 30 000 cas et presque 1 200 morts. Hier, on a déclaré un état d'urgence et prolongé l'état d'urgence sanitaire. C'est pour nous aider pour la protection de notre province. Et l'état d'urgence ne remplace pas l'état d'urgence sanitaire. Ça va nous aider à déployer les ressources dont on a besoin pour les contrôles aux divers points d'entrée. Et durant l'état d'urgence qui, à ce moment, dure 2 semaines, je veux clarifier que c'est seulement les gens qui ne sont pas des résidents permanents ou des travailleurs essentiels qui doivent appeler avant de venir à l'île du Prince-Édouard. Par exemple, si vous êtes résident permanent, vous auriez un permis de conduire de l'île. Et toujours, bien sûr, des exceptions comme les gens qui viennent ici pour des raisons humanitaires. Donc, si vous n'êtes ni résident permanent, ni travailleur essentiel, ou encore vous ne faites pas partie des exceptions, contactez l'organisation des mesures d'urgence par courriel. Et le courriel, c'est publicsafety@gov.pe.ca et le numéro, c'est 902-894-0385. Et puis, ils ont eu beaucoup de courriels et beaucoup d'appels depuis hier. Ce que nous faisons est très semblable à ce qui se passe à Nouveau-Brunswick et à la Nouvelle-Écosse. Nous approchons le week-end et je voudrais vous rappeler des consignes qui sont tellement importantes pour la santé et la sécurité de notre province. C'est important que vous n'oubliez pas ces consignes. Restez chez vous autant que possible. Sortez juste pour les essentiels et n'oubliez pas la distance physique. Et si vous revenez de l'extérieur de la province, isolez-vous. Pour les travailleurs essentiels qui viennent à l'île, comme les camionneurs, isolez-vous quand vous ne travaillez pas. Et puis, on a des appels, alors je vais mentionner ça. On ne prévoit pas de briefing cette fin de semaine, à moins qu'il y ait un grand changement. Par exemple, si je reçois confirmation qu'il y a de nouveaux cas. Et on continuera à tenir les médias, le grand public au courant des résultats de tests de dépistage par nos avis aux médias, nos réseaux sociaux et notre site Web. Comme chaque jour, je voudrais remercier tous les insulaires pour leurs efforts continus. Ce que vous faites et on fait ensemble fait vraiment une différence et nous avons encore du chemin à faire. C'est tellement important qu'on continue à respecter les consignes. On ne peut pas tricher la pandémie. Si on relâche trop tôt, on est à grand risque de la propagation de COVID-19. Trop court, on n'est pas encore là pour parler de relâchement aujourd'hui, mais on en parle et puis j'espère en parler plus la semaine prochaine. Je vous dis à tous les jours que nous allons passer à travers ça ensemble, mais aussi que nous le faisons maintenant. On est en train de passer à travers ça et on le fait bien d'une journée à la prochaine. Merci.
Hi, thank you and good afternoon, everyone. Health P.E.I.'s response to the COVID-19 pandemic is focused on limiting the spread and impact of this disease on P.E.I. It's also about ensuring we have the resources needed and available to respond to any surge in patients that may come. As shown by Dr. Morrison and Premier King earlier this week, the modeling gives a broad range of possible outcomes to this pandemic. We're fortunate to have a health system on P.E.I. that incorporates all of our services and is able to partner with our private providers as well. We're preparing for the possibility of a significant surge that could take place over the coming weeks and months. This includes securing additional resources such as protective equipment, ventilators, and space for adding beds if needed. Our planning and operational teams are looking at and preparing for what possibly could be needed. One part of this plan includes ensuring we've done as much as possible to protect our islanders living in long-term care homes. We know the virus has had devastating effects on these patients and islanders or residents across Canada and internationally. We've implemented no visitor policies in all long-term care homes and have done so early with Dr. Morrison's leadership. In addition to protection, as an additional protection for these islanders, with the recent public health order that took effect, all healthcare staff who work in long-term care who've traveled outside of P.E.I. for any reason must self-isolate for 14 days and not be at work. Within our long-term care facilities, we're implementing evidence-based guidance to limit the possibility of any outbreak. And while we hope to never have to, we also have protocols in place for the management of cases if they do occur. We're working in every way we can to protect those vulnerable islanders. Our virtual care services continue to expand with almost 100 healthcare providers now registered to take part in our video-based platform. As I previously mentioned, this will allow a secure video conference between healthcare providers and patients, providing increased access for health services while maintaining safe physical distancing. We're now We are now developing some public information to help patients and clients who are able to use this service with their healthcare practitioners. And so that will help them navigate the system and be able to use that well. We're working with our staff and physicians across the health system to ensure everyone knows how to use the right personal protective equipment at the right time and in the right way, so that our staff and patients stay safe now and have the equipment needed to remain safe in the future. I think the modeling from this week shows how important it is that we continue to plan and conserve our supplies now while we have minimal COVID-19 patients in case of a higher rate of infection or hospitalizations in the future. It's also clear that the testing is an important part of containing the spread of the virus, and we're very happy with the additional testing capability that our labs on P.E.I. have had that Dr. Morrison has explained over the past week. We continue to offer our cough and fever clinics as well as the drive-through testing in both Charlottetown and Summerside 7 days a week, and that will continue. On Thursday, we saw 79 patients in Charlottetown and 19 at our Summerside clinics. Dr. Morrison mentioned if anyone is looking to be seen through the cough and fever clinic or to have testing with possible COVID-19 symptoms, please call 811 or your healthcare provider to get access to that clinic. Finally, I just want to say a thank you to healthcare workers as essential workers, but all essential workers who are playing an important part in this pandemic response. And please ensure you're looking for ways to take care of yourselves as we continue our good work. Thank you for everyone in doing their part in responding to this emergency. Thank you.
Open for questions. Happy to take them.
Nicole Williams, CDC.
Hi, Nicole.
Hi there. My question is actually for you, Dr. Morrison, both of them. So the first one is, how long do we need to go without any new cases for you to feel comfortable saying we're on the other side of the curve?
So I've been asked that question actually a number of times today as well, and we've been asking even with the public health team. So I think that question really relates to my comment earlier about looking at the information across the world. European Commission has come out with some information around sort of de-escalation. We are having conversations with my colleagues across the country with this on the Special Advisory Committee, recognizing that different provinces are at different stages of this outbreak. And so trying to look at that as part of, so the answer to the question is really in part of how do we know when we can start to ease up and how do we do that? And it is, I think we'll talk more about it next week, Nicole, as we go forward. It's not just the cases here, but as we ease up, do we have the criteria in place that we can measure rise in cases quickly and be able to identify what's happening really easily? We certainly don't want to get into a situation where we ease up too quickly all at once, and then we'll never be able to really get back to this position that we're in today. So we do it in phases. So long answer to the question is there's not a specific day at this point in time, but we'll certainly talk about it as part of a bigger framework for looking at P.E.I. Next week. And I am looking forward to doing that and hopeful that we can have that discussion because we have not had a lot of cases in the last week to 10 days.
Thank you. And my next question is about the ferries, because earlier this week you mentioned you'd be having a conversation with Nova Scotia Public Health and the Northumberland ferries. I'm wondering if you've had that discussion, and if so, what concrete measures have you come up with for the ferry? Will you be turning away people on either side if they're traveling for non-essential reasons, and anything else you might have?
So I spoke with Dr. Strang in Nova Scotia, and we had a conversation with Northumberland Ferries, or our team did this morning as well, and I was there. And it, so we're having discussions, and I think there'll be an announcement in the next couple of days, and that announcement will come out of Northumberland Ferries. But they've spoken with Nova Scotia, they've spoken with myself and my team, and they will be making, giving further updates and announcement in the next couple of days.
Thank you.
You're welcome.
Louise Martin, CBC.
Hello, good afternoon. Actually, both my questions today are for Marion Dowling. So you mentioned, and I know Dr. Morrison mentioned yesterday, the 2 weeks of isolation for long-term care workers now, and that's new this week, new as of yesterday. Do we track, or do you know how many long-term care workers are coming from out of province? How many are leaving the province and having to come back? Is that something that long-term care homes have to report to Health P.E.I.?
Hi, Louise. Great question. I don't have a number for you, and we're hoping that the impact of making this change should be very low. We would have certainly staff with the number of employees that we have within Health P.E.I. and potentially the private long-term care homes. We would have individuals who may have needed to travel for essential reasons over the last 14 days to take a family member to an appointment at a province for medical reasons or other compassionate grounds and other essential needs that they may have had. So I have not heard that since the change it has had a huge impact on anyone who would need to now follow that guidance that works within our long-term care homes. Certainly, though, we're making some plans and trying to limit the movement of staff across facilities and within our homes as well. So some of that we're just working with the managers and directors of nursing and administrators for both the public and private long-term care homes to understand what impact that would have.
Okay, so just to clarify, that's a discussion that's happening now, and so we can maybe expect news on that in the coming days?
Yeah, we may. I think we're just monitoring and trying to put as many protections as we can in place while still being able to ensure that we have the appropriate levels of staffing and support for the residents who are in the homes.
Okay, understood. Okay, my second question, we know that Holland College in Charlottetown has 40 residence rooms ready as of today for healthcare workers. What is the current plan for those rooms? Who will be using them? And do we know when they will be used?
Yeah, there are some parameters that our Human Resource Department has been looking at and working with EMO, who's really been coordinating the efforts on getting some alternative locations for staff accommodations. If we are to have staff working within our facilities, either acute or long-term care, where we have COVID-19 positive patients. So they've put some parameters in place around the priority of access to that. So currently, thankfully, we have no positive cases within our long-term care homes or our acute care facilities or other service areas. Everyone is at home that's been determined positive to date. So I don't have a timeline on that, but what my understanding of it is now is that that facility is ready, and we have some processes in place for staff to identify themselves and have some priority for those employees who would be working directly with COVID-19 positive patients being able to access those rooms. And it would be for any employee who's working in that environment.
Appreciate your time. Thank you.
You're welcome.
Allison Jenkins, The Guardian.
Hello, yes. My question is about testing in long-term care homes. How many tests have been conducted in long-term care homes?
That's a good question. Do you have the answer?
Hi. I don't have the answer of how many tests have been done in long-term care homes, but I do know there have been tests done, and those are the tests that are identified as super rapid that need to happen really quickly, and that will continue to be the case. I spoke yesterday about our local testing capacity, so the majority of those cases are tests being available in 24 hours, but then a certain number of tests that can be done daily and per week that are done in 50 minutes when it gets to the lab. So tests from long-term care really would be a top priority if anyone develops symptoms. One of the things that we have been discussing with the lab as well in terms of testing in long-term care facilities is, and really there have been emails back and forth and discussions in the last night and this morning around making sure residents are tested on admission to long-term care facilities, whether or not they have symptoms, and then repeating that testing, and looking as we in the days ahead about doing some testing of healthcare workers who would be certain healthcare workers that might be moving from facility to facility and doing and having discussion about how many and how we can do that appropriately. So that's an ongoing discussion, and but certainly wanting to make sure that we continuing to test rapidly those who are in long-term care and those who are on admission, really.
Okay, thanks. And this might be a repeated question from another day, but how many of the super rapid tests have we been able to do in total? I understand you don't know the breakdown of seniors' homes, but how many have we managed to get done as we ramp up?
Well, so, and I think I said this yesterday, so in the last week we did maximum of 100 local tests, and those local tests were what we were considered rapid. And in going ahead in the next week, we'll do up to 1,000 tests here now. And some of them, I would suggest that having them back within 24 hours is also very quick, especially when you look at some of the tests around the country. And then, so there may be, the majority may still be within 24 hours, but others will be done very quickly. And that would be really healthcare workers, someone who's pregnant, who's going into labor, and who has symptoms of COVID. We'd want to make sure that they get tested. The long-term care, and anyone who's sick in long-term care, so those would be rapid, so even more rapid. So I think it's really, we're in a really fortunate position, and that capacity will just continue to increase here in P.E.I.
Okay, great. Thank you very much.
You're welcome.
Stu Neepy, The Guardian.
Hi, Stu.
Hi, good afternoon. Happy Friday to you both. Question for Dr. Morrison, I guess about the two of the three testing PCR kits that I guess Prince Edward Island is using now haven't been fully approved, or they don't appear on the list of approved devices from Health Canada. So I guess I'm wondering what that means. Does that mean that the results from these two devices, the positive and negative, still need to sort of be confirmed by labs off island, or how does that work?
Well, the testing machines and kits have all been approved by Health Canada, so there maybe it's just not on the website because they did get approval just before we got them here. We are sending for confirmation. All our tests do eventually go to the National Microbiology Lab at this point in time, and that's making sure that everything continues to be validated, which was the same for other provinces for a period of time, and eventually then we will not have to do that. But I know that same process took place in Halifax Forks and in New Brunswick, and that is the expectation here. So we're not using anything that is not approved by Health Canada.
Okay. I guess, does that mean that, I guess there was some sort of, I think it's called a special approval process that the island went through for I guess, those kits? I'm just sort of wondering why they don't seem to appear, I guess, on the list of approved devices.
I mean, I can follow up, certainly, and we can have the lab follow up with you, Stu. As far as I'm aware, we didn't go through any particular special process, but I can confirm that with the lab. But these are approved in the province, or they're approved by Health Canada, and we're using them here.
Okay. Thanks very much.
You're welcome.
Carrie Wynn McLeod, Ocean 100.
Hi, Carrie Wynn.
Carrie Wynn McLeod.
Hello.
Ocean 100.
Hi. Hello. My first question is for Dr. Morrison. Just talking about the temporary foreign workers and that they will be all self-isolating together upon arrival for 14 days in one scheduled spot. I'm just wondering, is there a plan in place, or what would happen then should one of these essential workers contract COVID-19? As to, where would they go then? Are all of the others that were self-isolating with them tested right away, or only if they become symptomatic?
Okay. Hi, Carrie Wynn. So when the temporary foreign workers are here, they're self-isolating. They're actually in their own individual rooms, and they will be treated like any other islander who gets symptoms. They will be tested, and then any close contacts identified up to, and that would include asymptomatic close contacts 48 hours prior to them developing symptoms. And then if they are well enough to stay at home, which most of our cases to date have been well enough to stay at home, they will continue to do that with the daily supports that all our cases would get here in P.E.I. And if they develop more symptoms, they will get care like any other person in Prince Edward Island.
Well, thanks. Thanks for clarifying that. My second question is also about the lobster industry. Now, we've seen reports from different associations right around the Maritime and what they are thinking about what they would like to request from the federal government. Here at home, the P.E.I. Fishermen's Association, says that the federal minister has pretty much said it will be a go, but if they want to do a delay on that, they need to make a formal request. But they don't want to make a formal request until they see or learn about what the protocols or the safeguards that will be put in place for the fishers and those in the processing plants as well. I'm just wondering, when would those protocols be made, Dr. Morrison? And, specifically regarding the processing facilities where there would be hundreds of people on a line that maybe on a good day might have 2 inches in between each of them. Is it possible at all to even self-distance in those conditions?
So, as you mentioned, it is a federal decision, and my understanding is that they are receiving input from different lobster fishermen associations. But I know from my perspective that we would want to try to support with the best advice we can the fishers if they go ahead and whenever that may be. And so we have been in conversation with the Department of Fisheries here in government, and I know they are working on with our input into guidance around seafood processing plants, but also for on vessels and on the wharf and all that surrounds it. And so absolutely a challenge, and so I'll be interested to see when the season will go ahead.
But what has that guidance been, though, for those processing plants?
Well, it hasn't gone out. I think there's certainly, we're looking at information, and I know the Department of Fisheries is looking at information that has been and is being developed in different parts of the country for the same area, and we are in the process of reviewing it. And I have, I've not been approached formally by the Fishermen's Association, but we certainly have been in discussion with the Department of Fisheries.
Thank you.
You're welcome.
Rachel Collier, Eastern Graphic.
Hello, I'm not sure who can best answer this first question, but Ontario has waived their 3-month wait period for people to be covered by provincial health insurance. And by doing this, they've made sure that, for instance, migrant workers coming into the province or anyone who has been living abroad will be covered by the provincial system as soon as they arrive. And I'm wondering, is Health P.E.I. considering waiving our 3-month wait period?
Hi, Rachel. I'm not aware of any decision around that at this point, so I'm sorry I can't answer your question, but it hasn't been something that's come to me or my table that I'm aware of to have a decision on that. So you may add something from the government side.
I'll just add that certainly at this point in time, if anyone who, for instance, needed a test to be done for COVID-19 or who is ill, those costs are certainly being covered regardless of whether or not someone has a health insurance card here from Prince Edward Island.
Okay, thanks. And then my second question is for you, Dr. Morrison, and it's after the 14 days of self-isolation. Do you know what kind of monitoring of housing and workplaces will be done by the provincial government to ensure that conditions are adequately addressing the needs of folks working through the temporary foreign worker program to make sure they are able to maintain physical distancing at home, on their way to work, and in the workplace? I'm thinking of processing plants here.
So there's two parts of the answer. So the first part is that there has been guidance that was just sent out this week for employers in the agriculture industry for temporary foreign workers that would really go over in quite a bit of detail the expectations for employers after that 14-day period, and so there's a similar one going out maybe today that I looked at last night for the employers of temporary foreign workers in seafood processing plants. So in terms of as you mentioned, accommodations. And then the other part is, for instance, in the agricultural sector, the housing would also have been pre-inspected by our environmental health officers, and they're working through that process. We have not had any large group of temporary foreign workers in the agriculture industry arrive yet, so it's given us a little bit of extra time to get that arranged.
Okay, and if a violation did occur, is there somewhere that somebody could report these violations?
So if someone is concerned about anything in terms of our self-isolation period, for instance, or concern about I guess the temporary foreign workers, they certainly, people have been calling the 1-800 line, and that is getting referred on to enforcement if needed.
Okay, thank you.
You're welcome.
François-Pierre Dufault, Radio-Canada.
Bonjour, Dr. Morrison. Vous avez mentionné un peu plus tôt que vous êtes préoccupé par la consommation excessive d'alcool ou de drogue pendant la période de confinement. Je me demande sur quelles données vous basez pour avoir ce genre de préoccupation-là?
C'est pas... c'est juste en général. Alors, c'est pas parce que j'ai entendu parler de plus de cas en particulier, mais on sait que les personnes me racontent qu'il y en a beaucoup de personnes au magasin d'alcool et on sait qu'en général, partout au Canada, on y parle parce qu'on est chez nous. La plupart du temps, on ne travaille pas et puis et c'est les choses comme l'alcool et les autres facteurs de risque qui augmentent des fois même la violence entre familles. Et alors, c'est juste un message en général. Et puis, je pense que c'est qu'on parle, même quand c'est pas pandémique, on sait qu'il y a des hauts niveaux, des problèmes avec l'alcool. Pour l'instant ici à l'île du Prince-Édouard et sans pandémique. Alors, c'est quelque chose qu'on s'occupe quand c'est pas le temps de COVID. Alors, mais c'est important d'en mentionner à ce moment aussi.
Quels sont les soutiens qu'on pourrait retrouver pour des personnes qui ont justement des problèmes d'alcool et ces problèmes-là sont amplifiés par la pandémie, par le fait qu'ils sont chez eux, qu'ils sont confinés? Quelles ressources est-ce qu'ils peuvent trouver en cette période où on parle beaucoup justement de la pandémie, de la COVID-19?
Et puis, je m'excuse parce que je pense que j'ai mentionné en anglais, puis j'ai pas en français. Il y a des ressources avec Health P.E.I, bien sûr. Et puis, il y a un helpline de l'île du Prince-Édouard. Et c'est 1-800-218-2880. Et puis, il y a aussi le courriel, c'est pas un courriel, c'est un website. Et je ne sais pas, j'espère que c'est en français, mais je ne suis pas certaine. Mais c'est princeedwardisland.ca/COVID mental health. Et puis, parce que c'est une place pour commencer, mais je sais qu'il y en a d'autres ressources qui est sur le site web pour indiquer les ressources pour les addictions et pour la santé mentale.
Merci.
Okay, merci. I'll just translate the last question that was in French before we finish. And it was really, was there a reason in particular? I talked about risk factors related to alcohol and drugs and smoking at this point in time. And it was really, in general, we know those are risk factors for our population and impact our health of our population without a pandemic. And we know they influence our outcomes. And so I think it's an important thing to mention at any time because of the risks associated with it and our use and misuse of alcohol, for instance, and our rates of smoking in this province, even when it's non-pandemic time. So thank you all. I hope you have a nice weekend, and I'll be back to see you over the weekend if we have an increase in cases or anything changes. Thank you.